right. Welcome back to the Shared Practices podcast. My name is Dr. Andrew Clingan. Today I have my good friend and coach and trusty sidekick joined, Caitlin. Caitlin, how are you doing today?
I'm doing really well. It's good to be on air with you and talking to our audience about the topic we have for today.
Absolutely. Caitlin and I, just in all disclosure, just got off a coaching call. It's great to schedule this stuff back to back. And so I'm just fired up. It's been a really great couple weeks at the practice. And there's a lot that she and I were celebrating, but also strategizing for the next, 6 months or so. We recorded a podcast a few weeks ago about growing through the ugly duckling phase. And my practice is still in the ugly duckling phase in some aspects, but also we're maybe seeing the light at the end of the tunnel. That might be premature, but what that really did, Caitlin, was it got me thinking about hopping on today and talking about productivity and scheduling. I scroll through Facebook groups, dental Facebook groups way too often, and I see a lot this time of year where naturally we slow down, right? The first quarter is probably our busiest, and then you hit beginning of the second quarter and you're fighting with spring break and you're fighting with end of school and summer travel, and people are busy and there's a million other things people want to spend their money on. And so you always see this time of year, these posts popping up going, hey, is anybody else slowing down? I'm noticing this. And like we as dentists get really nervous because I don't know where this comes from, but we just feel good when we're busy and doing something. Regardless of whether we're productive or not, we get like this sense of calm and feeling, looking and going, well, the schedule's full for the next few weeks without. And so that's what I really wanted to talk about today is the difference between a schedule that's full and a schedule that's actually really productive. And how do we protect our schedule and how do we produce? And when we think about like the one thing that we're very different on here at Shared Practices is how we view doctor production. We do not coach people to having to be super producers to have a successful practice. We have a lot of super producers in our ecosystem, and we have a lot of people who, in my office, we do implants and aligners and all this great stuff, big cosmetic cases. But what we really coach people to is just being productive with the everyday dentistry. And it's like, how can you do that? And the way you do that is with very intentional scheduling and systems around this sort of thing.
I'm really looking forward to diving in because there's so many different angles we can look at here. I think one of the first places I want to start is what is some of the most common schedule killers that are maybe some of them are obvious and some are not so obvious. And we can look at this from how we block the schedule and how we place our appointments in the first place. And then I think from your perspective, there's a lot that goes into back office operations and making sure you have an assisting team that is well equipped to not add their own schedule killers. So I'll just kind of start just with maybe some of the more obvious and the higher level. Having a protocol for how you want things scheduled in your doctor's schedule in your office, I think is important. And depending on the caliber of your scheduler team, that kind of dictates how much protocol you need, how many rules you need around the schedule. I remember when I started coaching, I was very anti-block scheduling because I had never done it before as a treatment coordinator or an office manager. And what I realized was my team was very well trained. We were taught just how to naturally build a schedule that had a little bit of everything, didn't, get in the way of a doctor adding in higher level procedures, productive procedures. Call it common sense, call it experience, but I had that luxury of every front office team member and every assistant that was touching the schedule. Like we understood, we had that intuitive understanding of how a schedule should flow for optimum opportunity, right? And then, coming into coaching and meeting with so many different front office teams, everyone kind of brings their own experience, either lack of or 10 years. And so sometimes we need some guidelines and guidelines are never a bad thing. And so I would
No.
say first things first, making sure at a baseline level that your team knows to allow a certain amount of highly productive appointments in your schedule every day. So your daily goal is going to look different than everybody else's. And then your fees and your insurance relationships are going to look different than everybody else's. And so I'll say for my clients, usually that means we're blocking at least 2 or 3 rock appointments or high production appointments, and then we're dictating for our team, well, what's that production amount that constitutes, okay, this is high level, this is a rock.
Mhm.
And some clients leave it at there. Others want to go in and add, well, let me show you where the mid-level appointments go and the low-level appointments go, and that's when you get into the pebbles and the sand of everything. So I don't think it's one size fits all, but I would say not having anything like that and not teaching your team about, hey, we need to make sure I have at least 2 of these anchored into my schedule every day so that the rest can kind of fall in around it. Like that needs to be in place.
Yeah, there's just listening to you talk, there's two things that immediately come to mind. And this first one's a little bit of a line in the sand and a hot take, and please feel free to disagree, but I just don't think there's any excuse not to be using block scheduling these days. For 99% of practices out there.
Mhm.
There's just, and I've actually been surprised when I talk to other dentists how many people don't.
They view it as a barrier to entry to the schedule. There's concern that it's gonna get more complicated and
Well,
people
I was
won't be able
talking
to get
to a
scheduled.
very good friend and seasoned dentist who runs a big successful practice a
Yeah.
while back. And he's like, no, we don't block schedule. I'm like, what are you doing? You know
I didn't
better.
used to either. I didn't used to
And
either.
yeah, so I just don't think the benefits are there. And I'll just tell you, like, spoiler alert, it always fills. Not
I know.
always, but
Yeah,
most
but
of the
yeah.
time it fills.
Well, we put guardrails in place, right?
We
So
do.
1 to 2 business days out, we give them permission to
Sure.
go ahead and just put something there,
Sure.
but we wait until
Yeah.
that last lit.
The other thing that, yeah, just right off the bat that comes to mind for me is you can't just go, oh, we're right scheduling now. We're going to magically produce more and it's magically going to fill it. Like, you have to be very intentional with training your team on the front end. And so you talked about the guardrails for them, but as someone who has brought on another doctor in the last 6 to 8 months, one thing we've had to really work on, and also as someone who's, I'm 3 years out of school. And so my clinical skills have almost reached a new level and peak and reset about every 6 to 8 months over the last few years. So, like, April of 2026, Andrew is a much different clinician than July of 2025 Andrew was. And I think for young doctors, you'll see that a lot, or doctors who are very invested in CE, in changing their skill sets. Like, this sort of stuff changes all the time. So what we had to do in our practice is we have a scheduling template for a doctor. So we have our one, we just do the simple rocks, sand, water. The one we've added recently is I've gotten into some more bigger cosmetic cases and stuff, are boulders.
Yeah. Yeah, I love it.
And that's scary because I typically, for a bigger cosmetic case, I block my whole afternoon and I'm not seeing anyone else. And so it's like, oh, is it going to fill? But most
Right.
of the time, the worst thing is wanting to present someone a $15,000 treatment plan and they're ready to go. And you're like, oh, I can see you in a month.
Right.
Like, that's terrible. And so, um, what we've done aside from the scheduling template is we have a Google sheet for each doctor that says, this is generally how long it takes them to do this kind of procedure, and this is what kind of block it belongs in. Because we've had, like, new team members join, we've had new doctors come in. And so it takes a time for the scheduling to kind of know the tendencies of a doctor. And so that's just one cheat code we've used early on that my lead assistant helps oversee is, hey, you know, Dr. So, and like, my associate doesn't need as long for an implant as I do. Okay. But I can do a quadrant of restorative dentistry much faster than they can. Right. And so that's kind of helped to systematize it to where it's kind of like thoughtless. This is just how it goes. And I think that's something you have to do on the front end is you have to create the value for this and be very clear, because then it's like, well, is a filling a water, or is you
Right.
go back and forth
Right.
and I don't know. And the patient's pressuring me
Mhm.
and all this sort of thing. So they just, go right into that right there.
And
So,
that's why, when I get started with block scheduling with a client, I will have them initially kind of use one of my templates and write out like their most common procedure types, what that production value is on average for those procedure types. And then every practice is going to look a little bit different about, okay, these 6 different options are rocks, these 6 different options are sand, and vice versa. And that's what I like about this type of block scheduling. It feels less limiting. We're just putting a production value to it. So it can be 6 fillings if it meets that production minimum, or
Yeah,
it
no,
can
that sounds
be,
miserable.
well, I understand. I understand that fillings are miserable. I
Yeah,
do.
it's fine though.
Someone
I'll
has
take
to
one for
do
the
it, though.
team.
I
I'll
think
take
that
one for the
someone's
team.
you, right? Yeah.
It is, unfortunately.
Yeah.
I'm the guy.
I know, right. But you could say that to your team, by the way, but if you diagnose it to the patient and you put it on the treatment plan that way, it's gonna have to get done that way, right?
Exactly.
Yeah, so you're actually the messenger, not me in this
Yep.
scenario, but,
They
anyway,
know not to dump, like they do know, like, you do not dump a full quadrant of fillings on Clingan's schedule at Thursday at 3 o'clock.
yeah, they
Like, you
get
just don't
that.
do it.
Yeah,
Nope.
yeah, mhm. So, putting that baseline in place of this is how long I need, these are these categories, and then you have that document moving forward to teach new team members as they come on. This is how long we schedule, this is what category this is in. And so, yeah, I think that will always serve you. And another column of that template that I like is I have doctor time versus assistant time for each of those procedures. And so let's not take for granted that we all understand which procedures doctors can easily step out of versus which ones they can't. And we don't all know at what point in the appointment a doctor can step out. And so that's something that new schedulers have to learn. And that kind of can be a schedule killer in terms of effective side booking. So I would say that's the next step is making sure you're having educational moments with your team about, okay, where the doctor can't be in 3 places at once. Where can I be here? Which, if we're going to side book this effectively, how soon should the next patient get started? So, I'll leave it at that. But I think, all of this to say you need a scheduling protocol. And it's gonna look different for you. It doesn't have to be
It
one size
is.
fits all.
And it's gonna change. And here's the thing that when I talk to a lot of young doctors about the buyer practice, I really encourage them to think critically about the following because most of the time we don't. Generally, if you're trying to come in and meet patients, the first 6 months to a year is not the time that you need to be focused on maximum clinical productivity and efficiency. You're really kind of like stepping over dollars to pick up pennies if you think about that, because so much of what our philosophy does is it emphasizes lifetime value of the patient. And yeah, I've just talked to friends and so many younger doctors that come in and they feel like it's a scary feeling. You have this big loan hanging over your back, and you're going in. You're like, "Am I going to be able to make payroll?" You're up at night thinking about all these thoughts, and you're like, "I just got to produce, produce, produce." But that can actually even be counterproductive. Like early on, your main job is to get in there and build patient rapport. And especially where I live in the South, people want to know their provider. And I think this is a real benefit to private practice ownership that you can give a patient that I'm sorry, but the DSO on down the street can't give is that you spend extra time. Now, if you're a PPO, you can't spend as much time. It's not, boutique, um, high end fee for service medicine, but you can let them know you. And like, those are the people that are going to stay and they're going to have tooth problems over the long haul of their life, and you're going to get to fix them. And so while all this is important, I tell people like your first few months, be very like give yourself plenty of extra room because you're going to have hygiene appointments that go 10, 15 minutes because Miss Johnson is just wanting to get to know you and talk to you and show you all the pictures of her grandchildren.
Mhm.
Right. And you can go too far with that. But I think that's really something early on young doctors need to hear. Like, hey, you have a whole career to do this right. You do not have to make all your money in the first 12 months. So like set yourself up for success. And this is how you do that. You give guardrails around where emergencies go. The hygiene appointments. I mean, the biggest thing too, you're wanting to grow a practice and you're sitting here, with your chest puffed up because your hygiene's booked out 6 weeks and you think that's a badge of honor for some reason. Newsflash, you're losing out tons of new patients who want to come see you that are not going to wait that 6 weeks, right? And you're paying some marketing company to do Google ads and you're lighting money on fire because you drive them to the website, you don't have appointments available for them, right? So all this is just so like it's so central. Like we could talk about this for an hour. We have a very hard stop today, so Caitlin's going to have to reel me in. In my practice, when we started doing this, some of the initial things was, especially protecting the doctor's schedule, was having this template, sticking to it, And then also being very clear with treatment plans up front and then requiring a deposit to get on for this major restorative stuff. That's another thing that when I talk to doctors, I'm surprised at how often like people are not requiring skin in the game to reserve a doctor's time. And I had that early on. I'll never forget my first December of practice ownership. Um, I felt like I did no crowns because we had everything blocked for crowns. And then it's 2 weeks before Christmas, and people would call a no show. It's like, oh, I want to spend $300 on a crown or $300 on Christmas gifts for people, right?
Right.
And so I just did fillings that whole month, and it wasn't a very Merry Christmas for me. I was like a Scrooge, and it was terrible. We required deposits to get on, and we push it a little bit further. Our front office team, just from an efficiency standpoint, we try to collect in full for patient portion when we schedule. Now, our practice did not have a history of requiring any of this, so we've been very slow at rolling this out. And if there's like major restorative that's needed, maybe somebody wasn't expecting to put, $1,500 down that day. So we kind of like use this with a little bit of discretion with our front desk team, but especially if it's under $100, all that's doing is requiring less visits to the front desk. And so your front desk can be taking care of another patient or greeting someone or answering the phone. And so there's just tons of ways that you can continue to take this foundation and build on it for practice efficiency, which I think is really needed these days. We talk about how inflation and insurance fees have stayed the same. Like the way you beat that is with efficiency, and it's by having clarity through this block scheduling, and then you can begin to layer on it more and more.
And those are guardrails that kind of go in line with training your patients to respect your schedule, and that allows you to protect your schedule and your time. And we have an episode on that with Coach's Corner that was released probably last year, and you guys can go back and listen to that. Just kind of philosophy around what do we require from our patients to train them to respect provider time and kind of build that mutual respect with their schedule and with ours.
Yeah,
So,
that can be the hardest thing too when you think about retraining patients, because the one thing that I think has probably changed a lot. You've been in dentistry and scheduling a little bit longer than I have, so you probably would be more qualified to speak to this than I would. But I feel like we live in a society that does not honor their commitments like maybe our grandparents' generation did. And so the
sure.
amount of cancellations and no-shows that we deal with in a dental office in 2026 is just way more than it used to be.
Hmm.
And yeah, share a little bit about like, we're talking about block scheduling, but it can be really disheartening to have the block schedule full and then you're just nailed with no shows and you have all these gaps.
Well, of course, and that's where, it comes down to what your philosophy is on do you hold your patients accountable for blowing you off, and
Yeah.
some are very anti-deposit, some are very anti-broken appointment fee, some are very anti-consequence, which is fine, but what that does mean is the only loser is going to be you as the practice owner and the dentist and maybe your associate, right? Because your patients aren't having a consequence. They don't have to pay a fee or put a deposit down. Your team is not having to have uncomfortable conversations because there's no policy for them to uphold. And they just kind
Hmm.
of go, okay, well, I have nothing in my back pocket to try to motivate you to keep this appointment. Other than maybe we can train them to open up those chart notes and look at why they were coming in and try to save it that way and build value. So I really would recommend having something in place that's some ammo for your team to
Sure.
hold these patients to their commitments. And maybe it's not a broken appointment fee. Maybe it's deposits. Maybe it is a three-strike rule where if they break it three times, we dismiss them or we put them on a last-minute change list,
Sure.
something like that. But you have to decide for yourself, like you get what you tolerate. And so
I've
it's
heard that
okay to be
before.
it's probably from me, uh,
Yes.
in many different aspects of practice
Yes. Yes.
management. Yeah.
I get you get what you
Mm.
tolerate. Talk from Caitlin about once every other month, I feel like.
Okay. All right. Well, you guys heard it here first. You
uh,
do, and so it's like you can feel sorry for
100%.
yourselves that your schedule's falling apart, but I don't feel sorry for you if you haven't protected yourself and trained your patients and your team to protect your
Hmm.
time.
Well, let's just speak to like the young practice owner, right? We attract that kind of doctor here, the one who's wanting to maybe take this practice that was underperforming and ready to grow. Most likely, if you bought that kind of practice like I did, none of this was being enforced. They weren't
Right.
paying at the time of service. They were getting billed afterwards, and they could just call and go, I'm sick. And they would go, oh, okay, well, will you not be sick tomorrow at 8? Great, come in then. Just like not. And so as you come in as the baby-faced dentist and you're having to make all these changes and like from day one, you're probably not going to be able to like, I mean, you could if you had a bunch of patients to just make them mad and, run them off. But you typically have to phase this stuff out and you have to be patient. And, unfortunately, you get what you tolerate. But at the same time, I think there's a strategic way to go about this. So in my practice, we're a lot more hardcore about some of these things than we were even 2 years ago. It's been like a slow burn for our patients. If you've ever heard like the story about putting a frog in boiling water, they'll jump out, but if you slowly heat it up, they'll stay. It's kind of like that. That might be a Southern thing. I'm showing my.
It is, but I
It
think
is.
it's an interesting
It is.
way to show that.
And so, yeah, we're a lot more. Our policy is early on, we didn't charge a cancellation fee because I was just trying to get them paid at the time of service and all this stuff. But then we implemented it, and we'll give somebody a free pass once a year.
Sure. Like, you have to
Generally.
have compassion. This is
Yeah.
a mutual
Or
respect that
if
we're
like there's somebody
establishing.
who, didn't show up to a 90-minute hygiene appointment scaling, they were in the hospital. I'm like, okay, I'm not heartless. I'm not going to charge you a fee for this. Like, that's just the cost of doing business. But we really have, we've gotten really clear on this and it's driven some patients away. And guess what? Those were the ones who were just never showing up to their appointments. So they can go waste another dentist time as far as I'm concerned.
That's right.
The
That's right.
reality is as dentists, we want to be respected and we're doctors and I agree. But unfortunately, society sees us more as retail these days.
Mhm. Mhm.
You're in their eyes, unfortunately, not a lot different than Great Clips. And that stinks to say, but that's really how a lot of it gets treated. We had a bad review last week because somebody got mad because they had to fill out too much paperwork. And I'm just like, man, I'm sorry. I'm shooting drugs into your body. I need to know
Mouth is
about
a
your
part of
health
the
history.
body.
It
Yep, that's
is.
what I always say.
And so it takes time to do this. And you can kind of choose your own adventure, right? Like some people may just want to cold turkey do it. And some people want to go, hey, we'll slowly raise the level on this. But I think it's also smart too. We've gotten really good in our practice about identifying where this is going to happen. So, for example, I can't charge a deposit for hygiene appointments at 6 months. That just isn't feasible. But if somebody's coming back for periodontal treatments, 90 minutes, 100% they have to have a deposit. We do a 6-week follow-up because that's the guidelines from AAP, right? Patients don't see the value in that follow-up. Why do I have to come for like the third time in 2 months? We make them prepay for that appointment. If they don't show up,
Mm.
they just lose it, right? And so you'll see in your practice with your patient base over time where the areas that you typically get burned are, and you can find ways to kind of navigate that. But yeah, I mean, like I'll just say like over time, when you do this, you train your patients right. On my doctor's schedule, I almost never have a no-show, ever.
And that's, you
If,
found what works for you, and
well,
it's gonna
and
look different.
when I do, what it is? It's typically low production appointments, like a
Mhm.
single filling that they didn't have that much skin in the game. People don't no-show my major restorative appointments because we require like $300 to $400 down, and you don't get it back if you don't show up. It's
Mhm.
amazing how that just magically fixes the problem,
Yeah,
you know?
and I would say just kind of last on this topic would be, you got to that point gradually where you had almost, the luxury to do that because you weren't in a scarcity mindset about filling your doctor's schedule. You were getting to a place where you were getting booked out more than a week, more than 2 weeks sometimes. And so
Mhm.
when you get to this point with your new patient flow and your active patient base has grown for the doctor capacity you have, you get this luxury of going, absolutely, get on my schedule. It's a $300 deposit. So yeah, and another area I want to touch on with schedule killers and is more the back office side of things. With this topic comes a lot of front office scheduling techniques, front office verbiage, patient education, patient training. But I think a really valuable angle that you can add to this for our audience is, what are the operational breakdowns that can happen in the practice if your assistants aren't fully
Sure.
equipped to work in same day treatment, let's say, right? Like we can block out emergency time and make sure we save room for it. But what happens if we're not prepared? So
Sure.
let's kind of wrap with the clinical and back office side of things.
Yeah, absolutely. And I have a lot to say about this, Caitlin. It's not enough for today's podcast. There may have to be another in the future. But as somebody in the shared practices ecosystem who's gone a little bit further down the clinical path than most people who've been on this podcast over the years, yeah, like I get really excited about this topic because ultimately you like your clinical back office systems make or break you as a dentist. Like you can be the best dentist in the world, but if you don't have good people around you, good systems, it doesn't matter. And the reality is, assistants and back office team members quite often these positions are turning over every 2 to 3 years in our practice. And so, like, how do we solve this? Because most dentists don't have a skill gap. They don't have a like people want to complain about supply expenses. Most dentists have a production and efficiency problem. They don't diagnose and get cases acceptance well enough. They don't craft their schedule in the right way. And then when they get the opportunities, they don't know how to be efficient with the time they have. And they're not able to work in the same day. They're not able to move through the day with efficiency. And what it comes down to more than anything is onboarding and systemization in your practice. And this is something I've worked really hard on in my practice in the last year, of how do we have our supplies set up? How do we have things set in the room? What training do my assistants go through? The one hack that I found in my practice when it's come to like the different departments is I can't have my hands all over the front desk as the doctor because I'm in the back, but I can have my hands all over the back office processes and training assistants. And so that's a cheat code as somebody like I would argue quite often, your assistant department should be probably one of the stronger departments in your office if you're a solo owner, because those are the ones you're spending the most time with. You're getting to do all this. And so where we've gotten to in our practice is we have people who are skilled, and there are different levels of skilled, and they all have different strengths and weaknesses, which are great. I have one who's really good administratively, even though she enjoys clinical. So guess what? She's kind of my lead assistant, and she makes sure we have all the stuff we need. Like there's nothing worse than having an implant crown on your production and you don't have the right scan body for it. So you lose out on $2,000 in
Right.
production that day,
Schedule
right?
killer right there.
Yeah,
Yeah.
like you want to be able to offer same day, but how many times an appointment does your assistant have to get up out of their chair to go grab something from the back? How much time do these people spend stocking stuff and things expire? Like, do you have a tip out bin system and an inventory system? And how do you transfer that to the operatories? Like I said, I'm not going to go too far down that path today, but all of these things matter and they make a really big difference on your efficiency. And then they allow you to like make up for gaps. Like if you don't, I'll tell you where I'm at. Like if I don't have a major rock and restorative appointment filled, Caitlin, they typically don't go to fill that with just anything. I would rather have the time completely empty. One, because I have an associate there now and administrative time for me is very valuable. So I'm cool having the admin time. But then two, the chances that I'll fill it with something productive on an emergency that comes in or a same day out of hygiene, probably about 30 to 40% most of the time,
Mhm.
you know? And we can do that because we've been very intentional about how we roll things out and how we train our assistants. And we've really lagged like, an endo appointment for us, all the paperwork on the front and the imaging and the setup and all that. Like we've worked really hard to tighten that stuff in our office. And so we just have the flexibility to, get the same day stuff in. I'm trying hard not to go too far down this rabbit hole.
Yeah.
Does that answer some of
No,
the
I
questions
I
we
think it
had?
absolutely does, and I think it just speaks to just every department has a role to play in this. I mean, I don't wanna leave the hygiene department out now, so I'll just say, of course, from the hygiene side of things, they can help move your doctor schedule along in a couple of ways. If you're fortunate to be in a situation where they can help you get your patients numb. One of the strategies I really like is to not only do that, but to make it work for everybody. And so for me, oftentimes that would mean the doctor and I or the assistant would go in and do the exam in the hygiene room, and the hygienist would step out and go get the patient numb in the other
Mhm.
operatory, right? So everybody's moving things along. We're all helping each other kind of move forward through our appointments. If you can look at that in the morning huddle and identify some traffic jams or some places where, hey, this person's coming in for limited, we might be able to do same day. It's just going to get a little bogged down. Why don't we do this? Hygienist seats the limited or the fillings appointment, and
Mhm.
assistant seats the hygiene appointment and get started with x-rays and exam, right? So there's a lot you can strategize around that. It's also, if maybe that's not the case in your practice, or in addition to that, it's training your hygienist to co-diagnose for you so that your
Mhm.
exams can be very efficient.
Sure.
knowing when you can jump in there at any time after they've done their data gathering so that you can get in and out and then move back to your doctor's schedule and your hygienists are flexible in that way with you is huge. So it's an all team effort and there's so many areas where our schedule could be lying to us looking full, but it's not
Sure.
necessarily productive time.
And the same thing, we spent most of our time talking about the doctor's schedule. The same thing goes for hygiene and perio and new patients. And so, guess what? When someone comes in on a limited, if we have the time, we'll often turn that into a comp. If there's a hygienist who has 5 minutes, they'll come in and perio chart them.
Absolutely.
And then guess what? We can get them in a
Yes.
60-minute cleaning appointment if they're healthy. Or we just know, hey, this is going to be perio. A lot of times at the beginning of the day, if that new
Yeah.
patient block didn't fill, we're looking on the doctor side. Who's coming in who we could move over? And so it once again, this is a very we're going to have to do a part 2 and 3 on this
But
topic.
you're looking at, okay, today, do we have time for something more with this patient? Because that's going to give them a better experience. They already took off work. Let's turn this into a comp if they want to come back anyway.
Mhm. Yeah,
And we're saving them time and we're saving our future schedule.
we are. And I'll end the episode with this. This is like, very real from my practice just 2 days ago. Okay. Just my encouragement for doctors would be like, do this. It will work. Have the courage to do it. I know it feels weird. There's pushback from the team, but here's what happened in my practice just the other day. Okay. I had a limited at the end of the day. This is a patient who's been around for a while, had a lot of treatment that kind of needed to be done, but would just do a tooth at a time. And cited finances a lot and all these different things. So she came in and had a crown off. And I'm like, okay, I'm sure it's one of the ones I told her that would need to be done. It was actually another one that was right next door to one that we had previously diagnosed. And so I go in there from the jump and I'm just talking to her and I notice like this patient looks different. Her demeanor's different. She was dressed different. Her hair looked different. I'm like, something has changed in her life. I don't know what. And so I just start talking to her and say, hey, this one, there's a cavity and it's next door to another one we talked about. Do you want us just to be able to take care of both of these for you at the same time so you're numb at once? And she's like, yeah, that'd be great. And then I had a few extra minutes in my schedule and I was like, Susan, we'll call her. Can I just talk to you for a minute? She said, sure. I said, I've noticed that over the 2 years I've known you, you've always had like cavities and had a cavity problem. You have a lot of old dentistry and that there's constantly something going on. I was like, tell me more about that. And she just goes about how, kid, she was always the child in her family who had a lot of tooth problems. I was like, has there ever been a dentist who talked to you about this? Or they just said, no, your teeth are bad and you're just doomed to a life of fillings and crowns. And she's like, pretty much that. And so I sat down with her for 10 minutes and talked to her about, how we understand oral microbiome and pH and all this stuff's different these days. And we use carry-free products in our office, which are great. And I was like, I would really love to I want to help you fix your problems, but I'd like to help you get to the root of it to where we're not on this cycle where you're fixing
Right.
stuff every 6 months. And she's like, that's great. And then turns out there's another tooth I diagnosed as a front tooth and it got worse, needed endo, new crown. And there was a bunch of existing other crowns. And one thing led to another, Caitlin. And in a 10-minute conversation that my assistants had framed correctly, I walked in there and it shifted from one tooth to um, basically a full upper arch and full mouth case, just like
Uh-huh.
that.
Uh-huh.
And my assistants knew we've just worked on this over the last 6 months. Here's the x-rays he's going to get. They came in and got the photos that they would need for smile design. Front desk already started running financing at the front.
Uh-huh.
I went and checked another hygiene, came back, looked at the records with her and just said, hey, I never want to push you into anything. We can do as much or as little. I stole that from someone else recently. That's not my own. But um, if I could just, I know like finances are always a concern, but if finances weren't a concern, would you just be interested in getting to a point where your mouth was healthy and we weren't doing stuff every 6 months and it was fixed? And she was like, absolutely. I was like, well, I can do that with phasing treatment, with 3D printing, prototypes, and financing. If I can do that for you, is that something you want to do? And she's like, yeah. Well, guess what, Caitlin? $1,000. We sold a $17,000 case right there. And guess what? Because I had a boulder blocked 3 weeks from now, she prepaid for the appointment. It's scheduled and it's done, and we're going to do it.
And you had the systems in place and the team in place to follow your lead and turn that into a very holistic, comprehensive appointment. And it took a little bit of extra time at the end of your day.
Sure.
but it
But
saved so
wasn't that
much
much doctor
time.
time, to be honest with you. All I had to do was care long enough to actually talk to her for a few minutes and not
Yeah,
just kind of put her on the factory and the machine of constantly getting teeth fixed.
yeah.
And so that's what this stuff does for you. I mean, once again, this is a broad topic. We could go a lot of different situations, but when you get intentional in your practice, you get these opportunities and then you don't fumble them when that happens. And every dentist would say, I want to do more life changing dentistry. I want to do cosmetic cases. Well, you got to be intentional about doing that. You can't do these things if you're just so focused on running in and out and being inefficient. And so that's the story I'm going to leave everybody with today. The take home message is intentionality, from the schedule to the training in the back, and just trusting the process. I promise you, if you run a well run practice and you have adequate patient flow, it's amazing what it will unlock for you. And then that's what gets you off the treadmill as a dentist. Like, everybody would love just to take care of one patient for an afternoon instead of running in between 15 different people, right?
Mhm.
That's the dream. And so that's what we're going to leave you guys with today. Caitlin, any closing thoughts?
I hope that this was valuable and everyone took some golden nuggets away from it, and you can go implement this in your practice tomorrow, whatever you did learn. If you're feeling like you want a little bit more guidance, some one on one help with this, just know that you can go to sharedpractices.com. You can schedule a discovery call with me. We have coaches that can help you with this, help your team with this, and just figure out what works best in your practice. So never hesitate to reach out. We'll talk to you guys next time.
Awesome. Had fun, Caitlin. Guys, thanks for listening to this episode of the Shared Practices podcast. We'll see you on the next episode.
Resonate.